Welcome to the very important Physicians and Kids presentation on parent empowerment and family leadership, brought to you by the Coordinating Center and our partner, the Parents Place of Maryland. My name is Faye Alexander, and I'm a certified community health worker with the very important Physicians and Kids program at the Coordinating Center. The Coordinating Center is a statewide nonprofit with 38 years of experience in care coordination services for people with disabilities and complex needs. We specialize in partnering with people of all ages and abilities, those with rare diagnoses, complex medical and special health care needs, and/or chronic conditions. We do not provide direct care, we coordinate care. We identify gaps in care and person-centered goals, and we connect people to medical and community-based resources they need to achieve their aspiration for independence, health, and a meaningful community life. VIPhysicians&Kids is the Coordinating Center's virtual, patient-centered medical home. Funded by the Maryland Department of Health's Office for Genetics and People with Special Health Care Needs and the Maryland Community Health Resources Commission. Our very important Physicians and Kids care team partners with pediatric practices in Maryland to coordinate care for children and youth with special health care needs. As you can see from this image, we connect individuals and families to a vast list of community-based resources and supports to help fill critical gaps in care. The goal of this presentation is to help families like yours learn more about the importance of advocacy. We aim to empower you to do what you do best, advocate for your child. This presentation will provide you with tips on how to prepare yourself to become the best advocate for you and your child, and perhaps even other children with special health care needs in your community. We will talk about how becoming an expert in your child's diagnosis can help you become an effective advocate, how building connections and establishing partnerships with your child's care team can lead to positive outcomes, and most importantly, how self-advocacy and self-care are critical to taking care of your family. You may be wondering why we are placing such an importance on advocacy when you are juggling so much as a family caregiver. You may also be wondering what advocacy means, what it means to be an advocate, and what advocacy looks like. Advocacy means to speak in support of something or someone, and an advocate is someone who pleads the cause of another person, and someone who stands up for that person's needs. An advocate can educate the masses, help spread awareness on the issue, inspire and connect others, encourage others to join you, give a voice to the voiceless, and result in change of policy and procedure. Think about the last time you talked with a friend about an issue that is important to you. You may not have realized it, but that's advocacy. In simplest terms, it is showing up, speaking up, and can even include getting your elected members of office to defend and protect the issues that you care about. Most of us advocate for causes we believe in every single day. As a parent or loved one of a child with special health care needs, you learn about advocacy very quickly. You have likely been advocating for them every day without even realizing it. In their school, in a hospital, in a medical clinic, with a specialist, an insurance carrier, even amongst friend groups. It's these experiences, yours and your child's interactions with all of these organizations and people, that form the basis for not only your involvement, but also your unique and valuable expertise as a family advocate. Families put the human face on the issue. Families are the users of the services, and you are the best testing ground because you understand the issues and have to live out the solutions. Advocacy is multifaceted, whether you are advocating for yourself or on behalf of someone else. It's all about giving people a voice. For self-advocates, advocacy provides a platform to share their stories and talk about how policy directly affects them. In the upcoming slides, we will look at what it means to learn, ask, become an expert, to partner and connect, to become a self-advocate, or teaching your child to become a self-advocate, and the importance of self-care in the process. These advocacy tips can be used with your child's doctor, hospital, clinic, therapists, preschool, childcare, classroom, and with family and neighbors. While you can advocate in support of a large group, you will always start advocating, of course, with one child, yours. I will now hand it over to Amanda Dayton, the Center's very important Physicians and Kids RN Care Coordinator, who will talk to you about learning, asking, and becoming an expert.
You and your child know your child best. However, learning everything you need to know about your child's diagnosis and needs can be a daunting task, as children and youth with special health care needs often require a lot of appointments with providers and specialists. Staying organized is key to becoming a good advocate. Find a central location to store records, one place where you and your family know where to find all the paperwork. Keep this information organized and in one place in a way that works for you. It could be kept in a binder, file in a filing cabinet, or in a box. What is most important is that you have access to key information when you need it and to find a system that works best for you. File information in real time. Sorting a large stack all at once is more overwhelming than doing it as information comes in. Start early and mark important events. Once you learn of your child's health condition, this is the time to start getting yourself organized. Keep a list of upcoming appointments and important milestone events. Keep records of any correspondence or conversations that you have had with the members of your child's healthcare team, which can include your pediatrician, specialist, educational support staff, therapists, counselors, and other professionals. Ask for copies of everything, whether it's a doctor's visit summary note, hospital discharge paperwork, or a school IEP. File records from medical visits, instructions for care, medicine lists and directions, photos or images, laboratory results, contact information, insurance information, and other important documents. Also, maintain your own notes. Don't just rely on papers to be handed to you. Record notes from visits with providers that will help you stay on task. When taking your own notes, indicate the meeting date and the name of the person you spoke with. If you are not a good note taker, bring a friend who is, or use a tape recorder or the voice memo feature on your phone. There may be times when you need to have a difficult conversation with a member of your child's care team. Remember to take time to listen, even when it is difficult. It is okay to not agree with every provider or specialist you meet with, but remember your why and who you are advocating for. Keep your child at the center of every conversation. At the same time, be open to learning new things. There are always at least two sides to an issue. By listening to all the sides and knowing the challenges you and your child may face will make you better equipped to advocate for your child. As a parent of a child with special healthcare needs, we know our child best, but at the same time, it is okay if we don't have all the answers. Lean in on your care team, your child's school, providers, specialists, and/or your coordinator. Ask questions if you have a concern. The sooner concerns are raised and recognized, the sooner they can be addressed and resources and interventions can be set up. Keep a list of questions in your phone or a journal that you can ask when you see a member of your care team. For instance, perhaps you want to know more about a recent diagnosis. One question you might write down for your child's doctor is, what are the warning signs which indicate that my child's condition is worsening, and what you should do if I notice any of those signs? If you are concerned about your child's developmental milestones, review the Center for Disease Control, CDC Milestone Tracker, which can be downloaded from the internet and discussed with your doctor. You can also talk to other professionals and parents to learn what resources and services are available. If you have a care coordinator, turn to them for support when you need a resource. Other parents can be a powerful resource to ask as well. Parents who have had a child with special needs know what you're going through and can be your best mentor in this new unfamiliar world. It also helps to know that you're not alone. The Parents Place of Maryland is a family-to-family network of families, professionals, and community leaders who are knowledgeable about children with special healthcare needs and resources in the community. Becoming an expert sounds overwhelming and intimidating. What does becoming an expert mean? It means being open to learning, asking questions about your child, their diagnosis, and their needs, speaking up at meetings with providers and specialists. As the saying goes, knowledge is power. You will be more confident speaking up for your child's needs, whether it's talking to a speech therapist, occupational therapist, physical therapist, a doctor, a teacher, or an IEP coordinator, if you have the information you need to speak up. It is also important to learn about your child's health insurance benefits. For instance, does your child's health care plan offer case management or care coordination services? If so, do they coordinate with other providers and programs such as hospitals, community-based healthcare providers, schools, early intervention programs, and/or the State Department of Health? Do they have any special programs that your child might benefit from? Are all or most hospitals with pediatric services in state or area served by the plan included in the network? Does the plan have policies or programs that promote the transition of adolescents with special needs to adult care and services? Can a family request that their child's pediatric specialist be the primary care provider? Does the plan offer mental health and behavioral health services coverage? Does the plan offer specific procedures when families disagree about care decisions for their child, including a patient member advocate, a mediation process, an appeal or grievance procedure? If your child has a new medical need and requires new treatment, does your insurance provider cover this treatment? By learning what is available through your child's health insurance, you will be able to utilize the resources available through insurance and will feel comfortable advocating to get services approved or dispute a bill. Your care coordinator can be helpful in navigating these issues. Next, Renee Avrit-Sanzone, Executive